We use the tool sort of like as a retrospective review. And so when we get a denial and say it's from Blue Cross or Blue Shield, we know they use MCG. So if it's a level of care denial, we use the tool to fight it. They met the criteria because of, and we use the tool that way. Utilizing the MCG guidelines, we have had a 38% increase in payments, using the tool probably 350 times, and we've brought an additional $3.6 million to our clients. The criteria are very clear, and so they're so specific that if you can have the medical records to support it, then, they have no choice but to pay it because we've met the criteria, the evidence-based criteria that are put forth for that particular diagnosis. We have nurses of all different levels, and so you can't all have the same experience. And so you can take a nurse that may not have experience in an area and give them the confidence to use the tool because they know what the criteria are for that particular diagnosis. And so you don't necessarily have to have worked in that clinical area in order to be successful with getting payments. I like the MCG guidelines because you can put a diagnosis in the search bar and it will come up with a whole list of diagnoses that are applicable to that particular diagnosis. You also can put in the procedure codes, the ICD-10 codes, and it pops up very nicely, and it's just like a little package with a bow on it, and you just click on the most appropriate one, and everything's right there, and it'll even at the bottom, and I learned this recently, has all the codes that are applicable to that diagnosis or, would be payable for that diagnosis, and that has been a huge help because if you can say, look, this code is coded on our bill. We know it's coded correctly. We have the documentation to support it. You just need to pay it. We do very, very well. Level of care, I think, is the best way for us to use this tool, just because it definitely supports the level of care that you've given to the patient.